Okay, it's 6:30. We do have a quorum, even though Dr. Geller is not with us. So we will start the meeting. I must start first with my script for remotely conducted open meetings. As a preliminary matter, this is Wendy Heiger-Bernays, Chair of the Lexington Board of Health. Permit me to confirm that all board members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dr. Bert Perlmutter.
Here.
Mr. Jay Flynn.
Present.
Dr. David Geller.
Here.
Ms. Susan Wolf-Fordham. Yes?
Yeah, I said here.
Okay. Health Director Carrie Sasportas.
Here.
And health professional, public health professional, Robin Chappelle.
Here.
Okay. And I called, and also School Superintendent, Dr. Julie Hackett.
Hi, here.
Okay, thank you. So the time is now 6:32 on July 15th, and I call this open meeting of the Board of Health in the town of Lexington, Massachusetts to order. Please note that this meeting is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth as a result of the outbreak of the 2019 novel coronavirus known as COVID-19. In order to mitigate the transmission of the virus, we've been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet remotely as long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting of the Board of Health will feature a short public comment period should time allow. For this meeting, the Board of Health is convening by video conference via the application Zoom as posted on the town's website, identifying how the public may join. Please note that the meeting is being recorded and some attendees are participating by video conference. Accordingly, please be aware that other people may be able to see you, and please take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Meeting materials, supporting materials will be provided to members of this body and will be available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda. The materials will also be shared when appropriate via the screen sharing from our, either from the office of, either through from Francis, who will be projecting, or Carrie Sasportas. Before we turn to the items on the agenda, please permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce each speaker on the agenda at the time we discuss after they conclude their remarks. Then, as chair, I will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and start your name before speaking. If you wish to engage in discussions with other members, please do so through the chair, taking care to identify yourself. After members have spoken, there may be opportunity for public comment, and the chair will ask if members of the public wish to speak publicly. Residents that have dialed in by phone should press *9 on their phone. For residents that have connected through the Zoom application, please click on the raise hand button. Finally, I don't think we will be taking a vote this meeting, but if we should, we will do it on the basis of a roll call. So let's get started with our agenda. So much easier in person. And we will start with the community health, public health emergency preparedness update, and starting with the COVID-19 disease update. Ms. Sportis, would you begin that discussion? I think we're interested in a combination of case situation, and we'll be going through a number of other items related to COVID.
Sure. As of today, we have 331 total confirmed cumulative cases. That's an increase of 3 cases over the past week. So our rate of new cases has been decreasing. We also have 57, which is a cumulative total of probable cases. And again, those are cases that are identified through antibody testing. There were 2 new probable cases this week.
Okay, thank you. And the situation report providing last week's materials is posted on the town website. Did we want to, are there any materials there that you wanted to share?
The item of note from last week, and again, I'll be preparing another situation report tonight with the new data from this week that was just posted for the standardized rates. From last week, every week I do a comparison of Lexington to the geographically adjacent communities in terms of testing rate, positive rate, and so forth. Lexington right now does have the lowest testing rate, but we don't know why that is. So it's just something curious to know. It may not, the only thing it might mean is that people aren't feeling sick and they're not seeking testing. So I don't know that we can really make anything of it right now, but I just wanted to note that.
Thank you. Go ahead.
We also did have a resident contact us this week, and one of the points she would like to make, and I think this is a good point to raise, is that when we break down the cases in Lexington, I've been doing every week, breaking the data down by gender, by race and ethnicity, by age. We do, so about 6% of the cases in Lexington are among people who have identified as African American, but 1% of the population in Lexington is African American. So this particular person wanted us to point this out and suggest, and I think this is a good idea for us to look a little more deeply into the data and to see if we can uncover some of the reasons why that might be. And to look at any discrepancies. And this is in the context of another request for us to do a deeper dive in the data to consider systemic racism as a public health issue. So I think it's really important with the data that we have to be looking with that lens.
Okay, thank you. And some of that information will be available based on your and Donna and David's follow-up. Okay, any questions of the board with regard to the COVID case situation? Testing, anything else? Dr. Geller, I'm going to ask you a question about your experience with testing and anything you've been observing in your practice.
We're testing a lot more people now, a lot more patients because of the increased symptom screening that we're doing. We're also having some people come in who want to get tested if they're traveling, and so we have an increased need for it, and we're doing it more. The one thing that we're running into trouble with is the turnaround time on our testing, due to I think the volume of the testing sites that we're using. It had been up to 24 to 48 hours. Now it's even up to 5 to 7 days, but we've been able to pivot, so to speak, and utilize other testing facilities to get more rapid testing. But yeah, we're doing a lot more every day.
Great. Okay, thank you. Anybody else have any questions? Move on to the next item. Great. Okay. Reopening plans discussion. What we're talking about here are both town buildings, town facilities, some of which are open to the public or will be open to the public. And then we will pivot, I think I use that word too, pivot, to the school buildings. So we'll start with, town, and I listed here as a subset, ventilation, disinfection, testing, notifications, and contact tracing, since all of those things are critical for our health staff to do the work that they have to do in terms of prevention, infection control, and disease tracking. So in terms of town, is there anything you can report, Carrie, or that you'd like to bring up?
In terms of the town buildings, my understanding is the town has a contract with environmental health and engineering for industrial hygiene. I'm not familiar with the scope of what they're working on. I have requested more information. I'm waiting to hear back.
Okay, and so this is in the context of ventilation and for example, the town office building, which will be open to employees, will subsequently be open to the public, making it imperative that we understand the ventilation. And I bring this up because certainly evidence now demonstrates that aerosolized virus, or one of the pathways by which virus is transmitted is through airborne transmission, and not just through droplet surface, hand to mouth, or direct sneeze. So it's critical that we understand what the ventilation situation looks like, what the disinfection looks like, what the notifications, how the health officials will be notified. So I think it would be important. I'm looking to the rest of the board as to their sort of take on having access to the information and perhaps a progress report with regard to the town buildings from the industrial hygienist. Anybody? Sue?
I think it would be a useful thing to have. I guess my memory is, and I may be wrong, that we previously asked for that, didn't we?
We did. And I think it would be behoove us, I think, to request a copy of perhaps the contract with the industrial hygienist, which is environmental health and engineering. We have confidence in them. We use them for the Estabrook PCB problem. And also to get an update on, or to get a progress report from them as their work progresses. So Carrie, I don't know whether we have to vote on that. Do we have to make a motion to request a copy? Anybody? Jay?
Thank you. Yeah, am I muted?
No?
Can you hear me?
Yes?
Oh, good. I don't necessarily know that we need to have a motion, but we surely can pass that information directly to whoever's in charge in the town. I guess, may I for a moment just back up a second and focus on ventilation. We need to have a schedule of the sequence and what actions I'd be taking in terms of preparing a request for a plan or project, execution of the plan, when the data would come back, when the BOH review comes in, and when decisions are made, and make sure that that timeline as provided by the town is consistent with their expectations of trying to open up buildings. From my viewpoint, I don't see that correlation happening just yet. I think it's quite imperative that it seems like, well, we'll just go, and meanwhile, maybe we'll catch up with the ventilation information. Maybe we won't, I don't know. So it's really putting out a request. I'm not so sure who the project manager is on that issue, but we can just state our request, and I hope there's enough town staff listening that the appropriate person will pick up and provide that information to us.
There is a director of facility services. I don't know who it is currently. I knew the last one. And I would think the request would go through that individual.
So
if I could jump in here, I just want to let the board know what I requested. Through my chain of command, I was instructed that the building commissioner would be the representative for the land use department that would be meeting with the H&E. So what I requested on July 8th was the scope of work with information about the sample methodologies, instrumentation, data collection methods, the raw data that's being collected, ventilation and air exchange rates for every room, and an outline of any central HVAC systems or unit ventilators. I have not received a response.
Okay, so we will formally then re-request the information that Carrie has requested that will be necessary to make sure that, or to at least see what the progress is. And then certainly when the facility is reopened, we'll have that, we will have information before that happens, excuse me. Sorry about that.
If I may,
Yes.
this is Jay. I noticed we have a number of town staff people listening in. Is there a chance any one of them can step up and accept that challenge to provide us that information? Silence.
Okay. All right. Well. All right, well then let's have a formal vote. That way it's on record that we seek to receive both the contractual information, conversation with EH&E, a progress report, raw data with regard to the ventilation and actually the buildings, the town buildings. Anybody gonna second?
I'll second it.
Okay, I will take all in favor. Dr. Geller,
Yes.
Dr. Perlmutter,
Yes.
Ms. Wolf-Fordham,
Yes.
Mr. Flynn,
Yes.
Dr. Heiger Bernays, yes. Okay, there we go. Okay, so let us move on to the school, both school buildings and schools. I've asked Dr. Hackett, school superintendent, to share with us sort of an update, not a sort of, an update of plans and anything else she would like to share, and we'll go from there. So Dr. Hackett.
Thanks very much for having me. And I think the first thing I'd like to share is my gratitude to the Board of Health for your partnership before the closure of schools, even as we were talking about presumptive cases in Lexington. And I remember we sat at a panel, the virtual panel. We were in person, but it was broadcast virtually on March 12th. And pretty much we've been in contact almost every day since. So I'm really grateful to the Board of Health and to Carrie for your partnership. This is certainly a challenging time for everybody, and being able to rely on our public health experts is comforting in an otherwise difficult time. We have a back to school blueprint, which you know about, and it is quite detailed, although there are many more details to develop as we plan for our return to school in person in the fall. We have a model, just to give you a quick, brief overview, and then I can take as many questions or talk as long as you want me to, or as briefly as you want me to. But the model essentially is focused in on a hybrid learning model, which would be where we take half of the 7,400, 7,500 kids, and we divide them into two cohorts. One group would be on a blue week, in which they'd learn remotely, and the other group would be on a yellow week, in which it would be in-person learning. So the idea is that we cut the population in half to reduce the risk, the amount of risk that is happening potentially in the schools. The sort of origin of the blueprint, or the back to school blueprint, came through many different avenues. We had lots of outreach during the planning process. So for example, we conducted 4 surveys, 2 to staff and 2 to our parents and families and caregivers. I conducted 21 superintendent chats with students, staff, and parents, and got a lot of feedback about how people were feeling about the 3-month emergency school closure, what they hoped for in the future, what worked well for them, what didn't work well at all, what we needed to work on and change, and what they were worried about. And there was a lot of fear and concern about safety and how we would come back. During our survey and data collection process, we learned from the public that we had about 63% of the population who wanted, and this is for parents and families, who wanted either remote learning or a hybrid model of learning. And then the other portion of the parents, and some people are talking about 37%, some portion of those parents were interested in a full return to school. And so thinking about the planning and then collaborating with our local public health officials, which you are, we kind of landed on the fact that the guidance that was coming out from the state was inadequate, especially considering the fact that we had been in kind of a very substantially separate situation for the last 3 months. We were completely restricted. And then the guidance at the state level was, okay, that the 6-foot distance that you've been practicing and that you continue to practice when you go into restaurants, and the mask wearing, now that's optional, and now we can all come back because little kids don't have COVID. And that sounds good on the surface. It's very much steeped in politics from my perspective. And obviously there are adults in the building. We have 1,500, 1,600 or so adults that we have to worry about, in addition to children. And reading through the studies, and David and Carrie and Wendy have shared resources as well. And I've done a lot of reading through other avenues. It's clear that what we don't know is what the impact is on children. So there are still many questions. It seems like it's safer, but we still don't know. As a person who has to take responsibility for the safety of all our children and staff, I take that very seriously and don't think that it's something to be gambled with. So I think we want to err on the side of caution, particularly when we've been completely isolated for the last 3 months. Seems like easing into a new way of doing school, and eventually a full return to school, which we all desperately want, is kind of the right way to go. So we've developed these models of either hybrid learning or remote learning, and asked people to make a choice, which is really hard for people to do because there are so many unknowns. By the way, it's hard to make a plan when there are so many unknowns, but I'm proud of the team that we have in our partnership, which helped us get a plan out. I think it was the first plan that was out in Massachusetts, and districts in Massachusetts as well as out of state have written directly to ask permission to use aspects of our plan. So I think that bodes well for Lexington, and it sort of gives us an outside perspective on the fact that we have made a contribution that we can hopefully be proud of. But that's not to say there's not a whole lot more work to do. We have a lot of work to do. So today is the quote unquote deadline for the selection of choices, either hybrid or remote learning to start the school year. And it has been difficult for people because they don't know what the health data are going to look like in September when people go back to school. They don't know what the state guidance is going to be. In terms of state guidance, we heard it was coming in June, and then we heard mid-June, and then we heard late June, and then we heard 1st of July, mid-July, late July. The latest update was wait, don't do anything, wait till the first week in August. Schools are very complex organizations. They don't wait for things like that. And I had a meeting today with 70 or 80 or so of our leaders with tons of questions. And I was reflecting on the meeting after and thought, you know, we have a plan. We have things mapped out. We know where we're going with this. I can't imagine being in a district where you haven't begun this conversation. And so I feel like we're fortunate that we have done a lot in that process. We got feedback on the blueprint. So the whole idea of the draft blueprint was to send it out to the community and ask the community, what do you think about this? No surprise to you that our community is not bashful, and they they tell us what they think of it, and they make some really good points that we're going to consider, and we'll modify the draft plan to reflect their good viewpoints. And then there are others that are going to be harder to reconcile. We also have a disclaimer in the draft blueprint that if we get an order from the governor or a directive at the state level that we have to consider, we're going to have to make some adaptations. The school committee meeting is on July 21st, next Tuesday, where they will hear the presentation and will analyze or summarize the analysis of the data, and then talk about changes that we've made to the plan based on feedback from the community. The community will have a chance to weigh in. We have something at the school committee that we've done for 2 years, which is called Community Speak. So at every school committee meeting, there are 3 times that the public can weigh in with whatever is on their minds. So that process will be in place. I'll do another series in addition to the 21 superintendent Zoom chats that I did before we developed the plan. I'll do another series of chats with students, staff, and families after the school committee meeting. So they'll hear the update about what we're seeing as a final draft. I'll do more chats. We'll have an opportunity to listen more, make more changes, and then on July 28th, the school committee will actually take the vote on the plan. The vote, at that time, the community will have a chance to weigh in during those 3 community speaks at that meeting. And the vote also comes before the state finalizes their plans by necessity. As I mentioned, when you have 6 or 7 or however many changes and promises of deadlines and dates, we just can't wait anymore. And if something needs to be changed, we'll go back and we'll call another meeting and we'll fix whatever needs to be changed. But I feel like we're on a good track. That's not to say that we don't have people with lots of questions about things, and we also have lots of things to still work out. But I think that we're in a good space. The other last thing I'll mention before taking maybe questions, if that's what Wendy would like, is that our vulnerable populations, we have a set of guiding principles that we use to develop the plan. First and foremost in everything that we've done is safety, health, well-being, and safety. And that's the lens that we operate from first. And then right after that is equity. And so making sure that our most vulnerable populations have an opportunity to be in school all the time is something that we've built into the plan. So students with disabilities in programs that are, where they need a lot of extra support will be with us in person both weeks, both blue and yellow, not just, every other one. And then we're reaching out to families to make sure that if they have hardships, we can work with them on helping provide support along those lines. English language learners, our students from Boston are also a consideration, an upfront consideration in the plan. So that's kind of the big overview.
Thank you, Julie. That was great. It was wonderful that the rest of the board could hear where you're going and the meeting on the 21st, in addition to the other conversations. There have been a couple of comments that I will read in the chat, and then I will open this up to brief comments. We'll just ask, we'll keep it to 12 minutes for 3 minutes apiece if people feel they want to say anything. So for right now, for the board's perspective, this was an information gathering session. We are not voting. We are not making decisions at this point. So one question, the shorter one, is can parents get one final chance after final details are available to change their selections? I don't know what that means, but you do.
I'm sure you don't know what it means, but I do. And the answer is we are going to work out a process for letting people reconsider whether they've picked remote or hybrid. What we've had to do is ask people to please honor the deadline, which is today, because we can't match staffing requests. And, you know, by the way, some staff are compromised and caring for family members. So we have a very complex puzzle to put together. So we're trying to figure out how many educators are available to us to do in-person learning and to do remote learning, and what is the student demand. And this is an interesting piece of data. We did a whole day-long data analysis with the planning team yesterday or the day before. And what we discovered is the closer that we get to the start of school, the more requests we're getting for remote learning. So people are nervous. They're looking at what's happening around the country, what's happening around the world. They're seeing that school systems are making plans to go back, and then when they get to their opening day, they have to pull back on the plans because they're not ready and the health metrics are not good. So what we're going to do is build into the process an opportunity for our families to reconsider their selection. But for planning purposes, we have to know what we're going into in less than, 6 weeks until the start of school, 6 or 7 weeks.
Okay, I'll read a few of the others and then we'll open up. The school blueprint mentions they will have half-day Thursdays to clean the buildings. Why is this not done on Friday when there will be no kids until Monday? So cleaning will be much more efficient with over 2 days of no exposure. Cleaning on Thursday when the kids and staff return on Friday for a full day of school seems counterintuitive. Would really appreciate if you can elaborate on this.
Sure. And actually before we released the draft plan, it said Friday, and I'd actually written Friday in there for the very reasons that the person asking the question is asking. You may see that change in the final draft. What I can tell you is we already have in place a half-day Thursday. So we were weighing whether it made sense to completely change the day. Would that be another change that threw people, or would it be best to just continue with the half-day Thursday? And while it's true that we included cleaning in that half-day piece, it's also true that it was more opportunity for our educators to get plans out in advance. One of the things that we heard from people that was a frustration, or our families, is that they would get the plans remotely. Maybe it was Monday when they got the plan while their child was trying to get ready for the week. So we don't want to see that happen in the future. We want them to get the plans out ahead of time so families have a chance to get it on their calendars and prepare. While it is about cleaning, it's about a lot more than cleaning as well. And Friday is certainly a possibility if people think that could work better.
Thank you. Let's see. Another question or comment is, how can high school have half the kids go 1 week and half the next with 30% overcrowding? The numbers don't work to allow sufficient social distancing.
Yeah, so people who attended the chats heard me say that we have a population at the high school of about 2,400. We have a planned operating capacity at the high school of about 1,850. So already we start at a disadvantage. Half of 2,400 is 1,200. Half of 1,850 is 925. So we have a delta of about 300 or so. One of the things that will help that delta is the remote learning opportunity. And we are seeing people selecting that. So if you think about just, roughly 10% of the population of 2,400 is 240 students, that almost makes up the delta with the overcrowding. Our standard is going to be 6 feet of social distance. The state is recommending 3 feet. And I do want to say that we've done the analysis, we've done the pressure tests, feasibility studies, whatever our homework assignment was from the commissioner we have done, and thoroughly. Part of what is problematic is that 3 feet, with that standard, you can get 30 students in a classroom at 3 feet. So 3 feet is what we have anyway. No contract that I'm aware of has more than 30, 32 students in the Commonwealth of Massachusetts at least. So that's pretty much what we have. The other problem with that is that it assumes that kids are sitting in the seats facing forward and learning in a way that they have not experienced in a very long time, if ever. Our learning model is collaborative, differentiated. When you walk into today's classroom, you don't see kids sitting in rows and facing forward. What you see are little huddles and people having conversations and talking about texts and having debates, and it's very interactive. So we're especially paying attention to the pedagogical implications, and we think that in addition to keeping our students and staff safer, that 6-foot difference will also make it less stressful. Because if you can just picture 30 kids, facing forward in a row, they can't move, it's lecture style, that's really hard on little ones. So anyway, the high school, I think this was about the high school to begin with, and I digress, but the high school issue, we're gonna be able to maintain the 6-foot social distancing. I should add the caveat that one of the things that we put into the plan, which you started talking about with the town buildings, is the air filtration systems and testing of those systems. So of all of the safety concerns, the aerosolization was our #1. And we started talking about that right away, particularly for the high school building, because it's old and the systems are, it could potentially be faulty. So I just want to say really quickly what our process is for the schools. And this has been discussed with some of you who are on this call and in the Board of Health and Carey now. So our Department of Public Facilities, I contacted him and said, hey, this is the concern. We're worried about the air filtration systems, whether the HVAC systems are turning over fresh air. That's the #1 concern. That's really on the minds of our staff members in particular. And I was told, Mike Cronin is the new Director of Public Facilities. I think someone asked for that person's name. And so he said, I feel really confident with my team that we have the kind of air exchange that we need. And he also pointed out that when we have half capacity, we'll have less carbon dioxide being released and those systems become even more efficient. So that is kind of step 1 for us. So we got the Department of Public Facilities to say, yep, our systems are in order. And then we said, but that's not good enough because you're just one crew who works on these systems. We want to know for sure that they're in order. So I asked them to consult with a company to come and take a look and produce reports. And they contracted with EH&E, Environmental Health and Engineering. They're in our buildings now, and we have to do some outreach too with the Board of Health, but they've started the process, or at least preliminarily. So that's our second look. They're going to produce reports. They're going to produce that long list of stuff that Carrie just rattled off, the raw data and, you know, all of those indicators that she wants to look at, because when I shared with Wendy and Carrie and Dave, here's what we're doing in terms of air filtration. I told them, you know, step 1 was Department of Public Facilities. Step 2 is engineering, health, and environmental health and engineering. And Carrie said that's not good enough. I want to know that we have the raw data and that we can analyze what EH&E has done. And they also said we need to have a written into the contract a meeting with them so that we can be sure that they're going after the right kinds of things and we can ensure the public safety of our students and our staff. So we have basically 3 checks on the air quality in our buildings. And the last step is going to Carrie for the review of the raw data. And I think with those 3 checks in place, it's really done a lot for our school community in terms of their fear about returning. And then the caveat related to how many people can fit in the high school is that if we encounter building or classrooms or spaces that are not safe and the air quality is not good, then that's going to impact how many students we're able to have in the building. And we're going to have to take some classrooms online. And obviously we're not going to put people in spaces that are dangerous.
Thank you. I think we'll take one more of the chat questions, and then if people want to speak up, then it gives, we'll do that. So there's a question, some would like to ask for more thorough data on the town's COVID situation to be made available to the public on a weekly basis. What is the age breakdown of new positives? More clarity around what the probable case metric means on the website. Is that number of active probable cases or total, meaning that there were 4 new confirmed last week and 56 probable? What has been the number of cases week by week through the course of the pandemic? And these are questions that I'm actually going to turn over to Health Director Carrie Sasportis to answer very briefly here, but I think it's an opportunity also for her to share that information more publicly, perhaps, excuse me, at the weekly select board meeting so that everybody hears it and it's out there. So I don't know if you want to respond here, Carrie, or we can just respond to what data are available and what are not.
Sure. This data is available. I produce it in a weekly report that we share internally. So I agree that this would be a good idea. If it's something that we could present at a select board meeting so it gets out, but we can also put this on the website. The probable cases on the website is a total cumulative, just like the confirmed cases. We do have a breakdown of new cases each week. So this past week we had 3 new confirmed cases and 2 new probable cases. And the definition of a probable case is a case or a positive test through a serum sample in antibody testing. So that's not the same as the type of testing that's done for cases that are confirmed. The confirmed cases are nasal or nasopharyngeal swab and PCR molecular testing. And that's the gold standard that the state uses to confirm to identify, it's a case definition of a confirmed case.
Okay. Let me ask if there are anybody in the public would like to speak, and if so, let's see, how do we do this? Carrie, you see who would raise their hand, right? And we will limit this to 3 minutes per person. We'll go up to, if we've got perhaps 4 people. Otherwise, you know where to find us. You can send us questions. Are there any?
I don't see any raised hands right now.
Oh, someone must have a hand.
Oh, here's a hand.
Okay, and when you are called on, can you please state your name and your address? Okay.
So Carol Webb.
Okay, I'm Carol Webb. I live at 11 Revere Street. I have incoming ninth graders. So I'm the one asking the questions about half the kids and the overcrowding at the high school. Could you please address the other two questions I put on the webinar chat just now?
Can you please repeat them?
So one is, what happens if stronger data come in about airborne virus? That the virus lasts longer as airborne particles in the air and not aerosol droplets that fall within 20 minutes. And so do you want to answer that, and then, or do you want both questions?
Just give us both questions, please.
So the second one is how I worry about it will only take a few people, student, teachers, staff, to come to school unknowingly infected, then getting sick or testing positive, where the circle of quarantine, contact tracing, and 14-day quarantine is going to shut down entire classes. But at the high school, because of the great degree of mixing, the school, have you done any modeling of how long the school could remain open in such a situation?
Thank you. We actually had intended only to have comments, but if Dr. Hackett wants to address whether modeling has been done, I'll just put out there that one of the conversations that will happen, I think, is sort of along those same lines, but of what would be the triggers, right? Would it be a single case that shuts down a classroom? How many cases would shut down the school, et cetera, and so forth? And those are conversations that we have not formally had yet, but we absolutely will be.
We've talked about the need to have them together. I guess I'll just share with you something that I heard the commissioner say, which I think we're going to have to go a step beyond. The commissioner had updated superintendents last Friday, and then he was on the Jim and Marjorie show. If you listen to the radio, somebody let me know. And so I tuned in, and he was on with the experts who have been helping the state sort out this problem. So a doctor came on, and they were contemplating the same question. And what they said is that they weren't sure that classrooms or even schools needed to be shut down if there's a positive case. And that is certainly not how we operated before the emergency school closure. And I think that there will be a lot of fear in the community relative to that kind of approach. So I'm very interested in continuing the conversation with the Board of Health about what you see as the best practice for the school system, and then making plans accordingly. But it admittedly is a very difficult dilemma. And you know, the easiest solution probably is full remote, but that's not the best solution either, because we have to get at some level of normalcy and in a way that is as safe as possible, with an eye toward how we bring everybody back full time, hopefully sooner rather than later, although I think it may be a while depending on how we see things work. Also, just to kind of address your cohorting question, one of the set of suggestions from the state and the guidance that's really good is around cohorts, and keeping kids together as much as possible and not mixing adults with different populations of students to the extent that we can. Anyone who understands how high schools work, we've all been to them, so we understand to a certain degree, knows that kids are all over the building and they don't run together in the same groups necessarily. They take different classes, they have lots of different choices. So kind of a major challenge for us is to keep the middle school, not so much the middle school because they do operate in teams, but it's still hard, but the middle school and the high school in cohorts to the extent possible, which is going to have an impact on the types of classes they can take. But going back to our guiding principles of safety first, that's got to be what we figure out, and we'll do that to the best of our ability, and then we'll figure out what can be offered safely after that. We're also talking about ways just to give the supports to students. Often, if you are an English language learner, for example, you would be pulled from the class, you'd be pulled in with another group of students, and you'd go to a different space. So we're exploring models for how we can minimize that kind of a pullout and have more of a push-in approach.
Okay, thank you. Is there anyone else? Sue? Carrie, are you able to let? So if you could state your name and your address, please, that would be great. Sue?
Okay, yes, I'm here.
Okay, go ahead.
My name is Sue Brigalow. I live at 34 Valleyfield Street. And my question is, I wonder if Lexington has explored using other town buildings for classrooms, as suggested in the Massachusetts guidelines. That would help with distancing. It seems like we have access to many buildings.
Yes, we have. In fact, people have suggested Grace Chapel as being a place that has lots of square footage. So we have considered that. One of the things that is a challenge for us that when we talk to health officials, they bring up is that the spaces that we use, first of all, aren't our spaces. So if we were to relocate kids to those spaces, we don't know who have been in those buildings. And we don't have control necessarily of how they're cleaned and the custodial support and so forth. And our director of school health indicated that there's a concern about contact tracing. So you don't know who's coming in and out of the buildings and spaces. So we have places on our radar. We have, feelers out about the use of space. We're a bit reluctant to expand in that way because we can't control other people's buildings. We can only control our own. But we've certainly explored it and have continued to have conversations about it.
So I'm not clear on what you mean by buildings that are our own. Like, for example, the library or the community center. Are those something that are our own, or I'm not clear?
Yes, that would be a town building, and we could have more control over those spaces than in another space or a nonprofit building or something of that sort. It's still very challenging to use those spaces because you have people coming and going, and we need to be really careful about that. But the answer to your question is yes, we have looked at that.
Okay, thank you. Is there one other, someone who might have a comment?
Hi, my name is Rajesh Godbole, and I live at 6 Tewksbury Street in Lexington. Given all the unknowns that we have today and all the risks that we have been talking about, with any option that we pick, there are risks associated. Have we considered any options such as starting completely remotely and gradually increasing the risk, introducing hybrid, eventually perhaps in school 100%? Have we considered any such model?
We have actually, and we say in the blueprint, it's in the executive summary portion and elsewhere, that people should be prepared for full remote. That could be a possibility. Depends on how the health indicators look when we go back to school. So we have conversations about what that will look like. And I think we need to be ready for anything. And I hope that we won't have to have full remote. I hope that things will be much better and that we'll be able to get back to normal soon. So we'll just keep our fingers crossed and see how things go for the fall. If you've watched what's happened in the United States, many states have had to dial things back. So they plan to return to school in full. Someone sent me the front page of the Miami Herald. This was last week. It was above the fold. There were two things above the fold on this particular day in the Miami Herald. On the left-hand side of the paper, it said, all schools will return in the fall. On the right-hand side of the paper, it said, all bars and restaurants are closed. So there's there's a lot of mixed messaging that's happening. And I also heard a great talk. There was a great article in The Atlantic, and Juliette Kayyem wrote it, and she was talking about the fact that schools have been an afterthought in this country. And she said it's not an issue of malfeasance, it's an issue of nonfeasance, that we haven't even been considered in the planning process. And as a public school leader, I certainly, that resonates with me, and I know it resonates with my colleagues. So paying attention to the planning process is important. And people are saying, how can we be talking about having plans for back to school in the first week of August? Why hasn't this been a top consideration on people's minds from the very start? And I share that question, but I do feel, good that we have been able to develop a plan and work through a process that a lot of people have had input into so far.
Okay, thank you. We'll take one more comment and then we've got to move on. There'll be a lot more conversations about this. And so we'll start with, we'll take a call from Dr. Rinaldi.
Hi there, Nicola Rinaldi, 19 Garfield Street. I actually just sent my comment through the chat because I wasn't sure if I would be able to speak or not. So I'm just wondering, given what we know about the higher likelihood of transmission in indoor dining areas, in bars, and from travel, obviously even more so to places where the virus is more endemic, is it possible for the Board of Health to make suggestions or requests around people who are, attending the schools, both staff members, faculty, students, families, to, basically not go to those places? I mean, I feel like we all have to play our part in trying to be as safe as possible. And I think, to me, having the schools as open as possible should be our #1 priority. And so I'm just wondering if there could be any kind of, obviously it can't be a mandate, we live in America here, but, just sort of a strong recommendation from the Board of Health to avoid those kinds of situations to help us remain as safe as possible.
Okay, thank you very much. There's clearly a lot to discuss. We are very thankful to members of this community for weighing in, for letting us know, I think. And this conversation won't stop. And I think I will speak for the board on this one, that our role is to protect the health of the community. And, we are looking at the data, the science, the regulations, and we work with the professionals, Ms. Desportis, Ms. Chappelle, who have years of public health experience, and, with Dr. Hackett at the helm, caring for our children and their learning, we will do the best we can do. So thank you. And we will move on to our next topic.
Wendy, just letting you know, there's 2 more hands. I didn't know if you wanted to get to those folks.
Oh, sure.
Okay.
Dr. Perlmutter it'll be okay, right, Bert? There's an S, a big S.
I have
that's
to
me.
unmute me. Yes,
Hello?
it's okay.
Hello?
Hello?
Hi. Can you hear me?
Yes, we can. Can you state your name and your address, please, and make your
Sure.
comment?
Yeah, so my name is Shubha and I'm from 171 Lincoln Street. So this question is for Dr. Hackett. First, I would like to thank her for being here and answering all our questions everybody had and answering our comments. So one question I had around parents reconsidering their decisions, once the final blueprint is done and parents are given a chance to reconsider. So I just wanted to check that we can reconsider both the ways. For example, some parents must have chosen hybrid and they may want to go remote. Some may have chosen remote and probably the numbers are looking great and we may want to shift to hybrid. So I just want to make sure we can do both the ways, both kind of shifts. And how does that work?
I want to be careful in how I answer this because we really have to plan for the fall and I have to have enough staff to be able to keep the kids safe. And it's going to be easier to switch from hybrid to remote than remote into hybrid, which is why we said if we don't hear from you, we'll just place you in hybrid as a default. But I'm also a pragmatist and understand that you can't realistically know everything that's going to happen in families. We don't know if people will be sick. We don't know what's going to happen. So we're looking at developing a process where people can make changes. We're trying to encourage people to sort of stick with what they requested to begin with, and then we'll follow through with the process for change moving forward. So we want to be flexible, but we also want to be practical and make sure that we have the right number of staff with our students. So I hope that answers your question.
Yeah, I think that does answer my question. So if I understand, it's easier from hybrid to remote rather than that. I perfectly understand because of the staff situation. Thank you. Thank you so much, Dr. Hunt.
Thank you very much.
And Carrie, there was one more person. Okay.
This is Kalpana, 22 Prospect Hill Road. I have a 6th grader and a 10th grader. So right now I have chosen remote, and the form clearly said it's for fall 2020. So we are only bound to our choice for fall, right? So in winter, are these choices reconsidered or it's carried on to the next season?
Yeah, thanks for your question. What we're thinking about is a January check-in to say, how's it going? And to see if we need to make any changes. So we're thinking about kind of a mid-year. And also, I didn't say this earlier, and it's not part of your question, but I do think it's worth mentioning. If we see students struggling in either model or families struggling, we'll be proactive and we'll be reaching out to people to see how we can help. And our number one goal is to make sure that our students are learning in as safe a way as possible. So we'll work with you on that.
Okay, so in January, every family will be given a chance to change their decisions.
We'll develop a process where you can access a change, and we'll lay out a procedure for how that can happen and still have enough staff to be able to cover what we need to.
Thank you. Thank you
You're
very
welcome.
much.
You're welcome.
Okay, thank you very much. We're going to move on in the agenda. Dr. Hackett, you don't need to, you're welcome to stay, of course.
Well, I like you very much, but I think if you don't mind, I'll sign off for now. I do a lot of Zoom calls, as you can imagine, and I know you do too. So anyway, thanks so much, everybody. I really appreciate it. And I appreciate all the questions from the audience as well.
Thank you.
Bye.
Bye-bye. So before we move on to anything other than COVID, and there really is quite a bit beyond COVID, I think. Anyway, I just wanted to close out the reopening plans discussion because there are multiple plans moving forward on a variety of issues that have to be reviewed in town as to their relevance for perhaps changes or decisions related to COVID. And I know that the Board of Health has been working with certainly the schools, the select board on both answering questions and making sure that we're all on the same page. And I think it's important that we make sure that we remain on the same page. And when there are issues that need to be raised, that we have an opportunity to do so. And so I think in doing that, we'll make sure, we need to just make sure that the plans that are proposed are reviewed for relevance to the health protections and the contact information that needs to be in those plans. Any discussion? Ms. Wolf-Fordham?
No.
Dr. Geller? Dr. Perlmutter? Mr. Flynn?
Thank you. Yes. Well, I'd like to, reinforce what the chairman has discussed, the fact that there are numerous plans going on across the town. I surely believe all of us are trying to work in good faith to make it the safest possible for all our residents as we go forward. But there's a lot to interpret in these state guidelines, and it is imperative that I think the Board of Health be a lead participant and reviewing these plans to ensure best practices for our Lexington residents, not only best practice, but and also consistent practice. And we've seen across buildings, retail, restaurants, park and rec, tourism, there are numerous ones. So I really want to encourage that we, the board, really consider that we really express the necessity for us to be such an active participant in review of all the plans. It's rather dynamic, so it's very difficult to kind of list what all the plans are. And surely, as I would potentially like to propose a motion here, but in proposing, I want to encourage that in terms of, in the end, it's probably the senior management as they take on plans being presented to them, that they pass down to make sure those preparer of the plans are really engaging the Board of Health for our review and participation. So in that context, Chair, I'd like to propose a motion if that would be appropriate.
Yeah.
I'd like to make a motion that the Board of Health requests that all public-facing COVID-19 decisions and documents be reviewed by either a Board of Health representative, the health director, or public health nurse before presentation to senior management for final decision. This review process must include time to incorporate any edits recommended by the Board of Health.
So that's your motion.
That would be the motion. A little discussion around that. I think that essentially is that kind of a key point here is that it's a very dynamic situation. We all appreciate everybody's working hard, but the process really requires that the Board of Health, through our representatives, get the time to review and get back and converse and have the edits incorporated prior to this plan be reviewed and approved by senior management. And we say that because we've had a few incidences of concern in this area. So I speak to this not to try to go back and review those situations, but rather the idea is going forward.
Dr. Geller, discussion, comments? You're muted.
I think it's a good idea and a good motion. I wouldn't mind hearing it one more time, Jay, if you would read that through.
He has to remember it now.
I have to remember. I apologize. I was always accused of mumbling. The Board of Health requests that all public-facing COVID-19 decisions and documents be reviewed by either a Board of Health representative, health director, or public health nurse before presentation to senior management for final decision. Review process must include time to incorporate any edits recommended by the Board of Health.
I think it's a valid motion. I think with the list of people who will review it, are those ors or and ors or ands?
Oh, ors.
Ors.
What is it?
Ors.
Yeah. Yeah, I think I personally would make it a either no offense to Dr. Heiger-Benes to add more work to her plate, but but I would make that a chair or the director and another member.
So, Jay, does your motion, so the motion is to review for public health content compliance at the time of the draft. Should the final version be reviewed as well?
Well, trying to be practical.
Yeah.
I struggle with the issue is that, you know, I've even listened to our select board and our town managers talk about having some sort of a working group, focus group that tries to solve this in this fast-moving situation. And that's had its issues. So I do struggle here that I would really try to say that the spirit of this is to really say, we need to look at that final draft before it's finally blessed, need to be able to review it and get our comments as appropriate into that final editment document. So I'm personally kind of leery in our dynamic situation to try to over-process this as what's going on. I think we all have to trust to work together. And if we review it and we identify our edits and we have a dialogue in those edits, we can share the confidence that everybody's working in good faith and they can get incorporated.
Okay, Ms. Wolf-Fordham, sorry, it's been a long day.
It's okay. I think we're all tired. I had a question for Ms. Sesportis. I'm sorry, Carrie, I can't see you. Okay, so you're still there. This is my question because I'm new at this. Whoever made that change, thank you. Now I can see everybody. So here's my question. Jay's motion refers to you or a public health nurse. I know we have an outstanding public health nurse here. Does that, if you're not available, does that public health nurse have the same or similar enough level of knowledge, or are there certain kinds of things that you, or I'm sorry, Wendy has to weigh in on? Do you know what I'm saying? I just don't know enough about public health nurse qualifications and experience. And I recognize that the public health nurse is very busy. You are very busy, Wendy. I know you're very busy.
To answer your question, Sue, yes. The public health nurse, we have contract public health nurses. Everything that I've received, that we've been given the opportunity to review, I have included the public health nurses' comments and also our contract nurses' comments. So those are incorporated. We do submit our comments, but my question, I guess, for the board would be, is there anything you're looking for after we submit the comments?
We're looking, I think, I would like to see that those comments have been addressed. They have been, if they're recommendations, they've been incorporated. If they're questions, then you've been asked to either qualify or to respond to those questions.
So in other words, if the questions aren't addressed, a reason why.
Right.
They aren't addressed. That
Right.
makes sense to me.
So how do we incorporate that? Unless, you know, we write this recommendation, we say that we seek to have the health capacity review, make recommendations. We are trusting that they will be incorporated, and we revisit this. That's anybody, any other members of the board, or Carrie or Robin? Oh, wait, Robin, you're muted.
I think sometimes when the health department makes comments, they might be included or they might not be included. And they're, Carrie's not even told in advance if they're included or not.
Okay. And so we need to make sure that, that A, if they're not included, that they are not included and why they are not included. And I think that would be helpful towards us being able to be in lockstep with the select board, right, in speaking with the unified voice in the time of, in this time of COVID. Jay, what do you think there needs to be a?
I know it's been a great struggle, and we unfortunately have had instances where you know, the comments may or may not gotten copied. There's not a response back. I remain optimistic that by making this motion, we are really alerting to, especially to our senior management and all the people doing it, that we are a necessary part of the review process. I think that essential element has not existed to date. I've been concerned that, you know, they throw it at us. Excuse me.
Right, Carrie.
There's a more professional way of saying that. We get them last moment, and I think that even possibly the people who are writing, you know, writing these plans are not necessarily working in bad faith or anything like that, but they're not really know that they are supposed to truly engage the Board of Health for their review and comments. So I remain optimistic that with this kind of emotion and attention from our senior management that this actually happens, then we can achieve our objective. And I guess, and the other part of it is I'm not so sure how we can refine it anymore at this point anyways.
Well, one suggestion I had to the board, would the board be more comfortable if they had final review?
Is it, oh,
Oh,
sorry.
go ahead, Ms. Wolf-Fordham.
Is it too late in the process if we only have final review, or are you saying have initial review and then final review?
And I'm not going to make a decision for the board, but what I'm trying to say is that things can change in progress. So the version you comment on might not be the final version. So what I'm asking the board is, do you want input into the final version?
I think in the end, that's what we would like, is we'd like to be able to sign off and say, yep, that's it, hand it off to the select board, here it is, everybody's on the same page. So the answer, I think, in my opinion, is yes. We do want to sign off on the final version. We recognize that time is of the essence. And I actually think that once the plans start moving in this direction, right, with the health staff input at the sort of draft stage, with the review at the end, that once that happens, it will continue to happen that way because, you know, we will know what we should be looking for. Yes, Sue.
So are we now saying that we're requesting initial review by the health department and final review by the Board of Health? I'm just a little confused on how on where we have evolved to.
Well, I think we agreed that health staff needs to be, well, it was the Board of Health, health director, or public health nurse needs to be involved in the drafting of the plan. I think then that there needs to be final review by those same parties, or.
Okay.
Does that work?
That works for me.
I'm okay with that.
All right, how do we, Jay, can you?
I'm working.
All right. All right. Anybody got a joke?
I'm gonna think out loud. Carrie, kind of looking to you is that could we just add that the?
No, read the whole thing.
Pardon me?
Read the whole thing, please.
Well, I was gonna try to draft the last part of the comment.
Okay.
And I was just simply saying, would it possibly be acceptable that the health director be provided a copy of the final plan
Document.
prior to presentation?
I think it's it's review of final document before release or
Okay.
before whatever. Carrie, what is it? Before?
I don't want to put words in anyone's mouth.
I know, Robin.
I just
don't.
raised a question.
Before implementation of a plan.
Thank you. That's it. Before implementation. Thank you.
Health director.
I'm not sure it should be limited to the health director because we already said the
I
health
think
director, the public health nurse, or a representative of the Board of Health.
Perfect.
Because availability is also an issue.
Yep.
I think for us to be involved is the major mandate because we haven't been all the time, certainly historically over the years, long before COVID-19. So to put this in motion, it's a request anyway. We can make a request as a board, but I think we should make that request and define it as input of those named parties, or with the ors rather than the ands, in the process and then on the final review.
Before implementation.
Before implementation.
Right.
I don't know how to word that.
You got it. You got it. You did it. Jay got it?
I'm struggling. I'm struggling with the fact that, you know, when we got a draft done, comments made, gone back, hopefully a dialogue, if there is any, about the edits that get incorporated. Then the person writing the plan is ready to present it to the senior management for their review, for their approval. And we're saying after that's all done, then we want to have one more shot at it before implementation.
Yes, it's a review before implementation of the final document, a review of the final document before implementation. Okay.
All right.
So essentially the Board of Health has input on the plan and has final approval, right, before implementation. That's it. So how about this? Make a motion that the Board of Health requests that all public-facing COVID-19 decisions and documents be reviewed by either a Board of Health representative, the health director, or public health nurse. And that the review process must include time to incorporate edits recommended by the Board of Health with final review of the document before implementation. I can't repeat it because I can't remember. Okay. A second? It's recorded, so okay. Dr. Geller.
Second.
I'll go around. Mr. Flynn,
Yes.
Dr. Perlmutter,
Yes.
and Ms. Wolf-Fordham.
Yes.
And I guess I made the motion, so okay. Yes.
Great.
Okay, let's move on. Oh my gosh. All right. We will move on to the emergency dispensing site plans should we ever have a vaccine. That would be Carrie.
I'm wondering if Robin would.
Oh, Robin, that's right. Sorry.
Sure. So, so far I've worked on drafts of memorandums of agreements between the Office of Public Health and the police, the Office of Public Health and Fire, Office of Public Health and DPW, Office of Public Health and Town Manager. And those would then spell out exactly what their responsibilities are and the health department's responsibility, the Office of Public Health responsibilities are. Carrie has them, she's reviewed them. She's waiting to speak to the town manager before we send them out to the other departments. They know that it's coming because that's something that we talked about in our meeting. The other thing that I did was I wrote to the facilities manager and assistant facilities manager asking them for the indoor EDS site, if we could take a look at the high school and ask them for some maps and if they had suggested rooms, because that was something that when we spoke to fire, police, and DPW, they all suggested that we use the high school as the main for if we were doing something inside. So I'm waiting back to hear from them. I haven't heard back from them yet. And then other things that that I've started working on was, we have a very old call list in an emergency who the health department has to call first and within an hour, and then who they have to call within 2 hours. Most of the people on the lists are no longer there. So we're starting that again. And then other things that Carrie asked me to take a look at is to make sure that we put the drive-through in our EDS plan, to put the critical staff dispensing. We've updated that. Cold chain storage. And then Sue, Carrie had given me some demographics of Lexington. I wanted to share that with you as we think of putting any special needs that we need to do into the plan.
Sure. So just contact me anytime. I'll be happy to talk to you.
Anything else that I'm missing on that, Carrie?
If I could just add one update, we had a public health regional coalition meeting today, so we got some updates on the new budget period. So one of the items on the work plan for the whole region, so that includes Lexington and other surrounding communities, is incorporating more detail in terms of non-pharmaceutical interventions, which would cover the vaccine dispensing type scenario, but also isolation and quarantine. So that's something that they're going to develop a regional template and then we'll customize locally. So that's coming.
Great, thank you.
The other thing that's coming regionally is that they've been developing a security plan, and then just to incorporate that for a Lexington special needs. But before we can work on that, we have to have the okay that we could use the high school, because that wasn't one of the locations.
Great, thank you. Okay, should we move? Go ahead.
Can I raise my hand?
Carrie's in charge. Can't see anybody except.
Go ahead.
I had one comment. In one of our previous meetings on another subject, we have the emergency preparedness group response team through the fire department and safety office. They have a list of the call list for all of the emergency response team. And I would think that there would be a good basis to correlate with that list, which is surely kept very current, and therefore refer to that so that we're not trying to create a separate list that would have all the inherent problems of being maintained as current.
So the emergency dispensing call list that we have is for like public health emergencies. So in the first hour, actually, all the board members should be called, the police chief, the fire chief, and the town manager.
Okay.
And then the second list within 2 hours is people that have some sort of action that they have to do to open up the emergency dispensing site or role that they're playing. So it would have to do with people that the IT person, it would have to do with somebody in the DPW that's actually helping set up the facility or bringing some of the materials over that we need. So the call list is really specific for a public health emergency.
Thank you.
Yeah, if I could just add clarification, this isn't about emergency response, it's about activating a dispensing site. So that would be for medications or vaccines. So it's a very specific targeted group. It's just that the last time this was done was a number of years ago, so there's been turnover in staff.
Okay, thank you. Thank you, Robin, Carrie. Shall we move on? Cooling center plan and heat action plan update, please.
So we've had a couple of meetings with Human Services, with Fire, and Robin's been there as well, to discuss the potential operation of a cooling shelter in light of COVID-19. So under normal circumstances in the summer, in the high heat days, the public pool would be available, the library, the community center, but none of those options are available right now because of COVID. So this is really targeted to look at what options we can make available for people who are really at risk to high heat, and may also have risk factors for COVID. So it's one of the places we've looked at are some of the modular units at the high school. And we've also talked about in public housing, the community rooms. So what I've done, I've taken a template that I have that we're working to customize for Lexington. And
Great.
that would include things like activation triggers. So are we talking a heat advisory, excessive heat watch? What are the steps at each phase that different town offices or departments would take in order to activate, and at what level of activation? So it could be as simple as putting messaging out there, and what are the messages that we have pre-scripted to put out there to reach our target population, all the way up to full opening of a shelter.
Okay. Any other questions about the cooling center plans? It's great you're doing it. Thank you. Fall flu clinic planning. Oh, this should be fun, huh?
I'm gonna let Robin take this one.
I feel like that we are like the bearer of bad tidings or something, you know?
So Carrie, David, Donna, and myself had a Zoom meeting just to go over the logistics. We want to do the drive-through. We're probably going to be having less flu clinics this year, just because we don't know what the demand for contact tracing is, and what David and Donna's and Carrie's time is going to be spent on that come in the fall, with if there's another wave. So we're right now limiting it to 2 drive-throughs, one for seniors and one for families. And we're we want to make sure that we get the message out. One of the big messages for CDC is that we're trying to tell people that if they haven't seen their regular physician, this is a good time to schedule an appointment with them, and that they can hopefully get their flu vaccine with them, and that there's other places that they can get a flu vaccine, because we're hoping that more people are going to be getting their flu vaccines this year, even at the same time where Lexington in the town is going to be doing less than that. And then we're also looking at other things that David would need, to prepare for the fall flu clinic. besides messaging, which is the big thing that we're going to be doing this year, is the messaging, but just how many people he can put through the drive-through. So he has to come up with a number that way. We're looking at pre-registration. That'll be something new. So we're looking at some of the options with that. But anything else that I'm missing with that, Karen?
So I just wanted to add, thank you, Robin. Wanted to add just the context that the reason why these changes are happening is because of COVID-19 and because of the extra social distancing considerations that we have to account for. So while it sounds counterintuitive that we'd be offering fewer flu vaccines this year than in previous years, it's because we have to increase the safety and operation of the flu clinics. So in the past, where we've had very large general population or specific population flu clinics, they've been held in a building, people line up, they're in close proximity. That's a lot harder to do in light of COVID-19. And so most communities are moving to a drive-through model for this flu season. We also have a couple of templates that the state just released today that we can use for planning purposes. But as Robin said, one of the big things we need to calculate is throughput, staffing that's going to be needed. We've taken a look with DPW and other officials in terms of the layout of the site that we plan to use and how we're going to get more than one lane of traffic in case people need to be monitored or need to pull aside. We've discussed some of the logistical issues around how many people in a car. Are they going to be close to, people in the car might not be sitting next to a window. So how do we vaccinate those folks if we're trying to keep people in their cars? So there's a lot of logistical considerations that we have to work out. The main thing that we need to have a better handle on is the availability of PPE. So right now, there have been some issues with our supply chain that we normally use, but if we're not able to get the appropriate PPE to hold the event, then that's the biggest consideration up front.
And even the type of PPE that we need, one of the things that David thought that we might need is sleeve protection, but we might not need that, but we would definitely need face shields, and we don't know how we can get those right now. So.
In terms of numbers of vaccines, is this also playing into sort of the numbers piece? Or is
there is a little bit less availability. David's already made the order, so we're not concerned from that perspective, with the understanding that we are scaling back.
And I'm going to turn to Sue about her questions that she might have regarding people with special needs.
I think they're almost the same for the cooling center, for the EDS and the flu clinic, and it's about accessibility. And I just made a note to myself, Robin and Carrie, to send you this really great article that addresses some of those issues, and then I could talk to you after I send you the article.
Well, one of the things we discussed with the Human Services Director, they have a nurse position. It's currently vacant, but that particular position is usually the one that goes to homebound seniors and has historically in the past done flu vaccinations that way.
And we've asked David, and I think they've done about 18 a year.
It's been a small number.
Right. So, but that's something that if that position does become available, that was something that we did talk about at our meeting, to use a person that can go in-house to some people during this time. That would be really helpful.
Okay. Thank you.
We also have, excuse me, one other thing, in the plan for the drive-through, an area where if people need extra help filling something out or trying to understand something, that we would have another area that would be for special needs that they can go to, that wouldn't slow up the rest of the line.
Great. Thank you. Any questions, comments by the board? Okay. Sharps, oh no, sorry, Household Hazardous Waste event update.
So there's an event, this is the first event that is being held in several months. The last several, I think going back to April, have been canceled because of COVID-19. So we've spent some extra time working with the coalition communities, the Minuteman communities, to determine how we can offer this service safely in light of COVID-19. And so we've come up with a protocol. We're holding the event on Saturday. David, our public health nurse, will be there along with volunteers from a few other communities, Waltham and Arlington. We're going to have some DPW people on site. I believe we have extra people on hand from the police. So we're prepared to do things slightly differently. This event, we're going to have the waste hauler, which is Clean Harbors, do the registration on site. In future months, what we're moving to is a pre-registration model. Some communities already do pre-registration. Lexington historically has not been one of those communities, so it will be a little bit of a learning curve for us. I'm working with the recycling director at DPW and our IT department to come up with a solution for the pre-registration that can be done online.
Great. Okay, so everybody can bring their, I don't know, what they've been collecting, all their art, no, I don't want to go there. All the stuff that they've cleaned out in the past 4 months.
So one of the things we're doing differently is that people are being instructed to keep the items in the trunk of their car, or if it's an SUV, in the back of the SUV, if it's a pickup truck, in the bed of the pickup truck. So in these future events, while we still don't have a vaccine for COVID, we're not going to have staff going into the back seat of someone's vehicle to collect items. And sometimes people will bring containers that they want to get back. Unfortunately, we're not going to be able to give those containers back this time. And these are all considerations that we've built in to prevent COVID-19 transmission.
Okay, great. And fortunately, the folks from Clean Harbors are already in Tyvek suits and PPE.
Yeah,
and,
yeah.
Okay. Let's move on. Sharps medical waste update.
So there's nothing new, but what I can say is the status quo is that we have not been holding Sharps or medical waste events. This was a decision that was made on our public health team with the public health nurse, primarily because of the population that we tend to get at these events tends to be people who are over the age of 60. We want to make sure that we can hold them safe, hold the event safely. We don't want to put people at risk. So this year's events, the event that was scheduled to be held in June was canceled. There are alternatives that are listed on our website. The Sharps kiosks and the medical collection kiosk that's at the town office building, those have been locked since March. Also due to COVID-19, when the town office building closed to the public, we made the decision to close the kiosk because we do get a number of questions when people are trying to use the kiosk, and they usually come into the building to try to ask staff. We've been on a lower staffing model, so we want to make sure that we can offer that service safely.
Okay. Any comments? Sue?
I certainly agree with that decision. I just wanted to let everyone know that a resident called me and expressed concern about that, about the fact that the kiosks were closed. After speaking to Carrie, I let her know about the website, let her know that I would be mentioning it at this meeting. I think her main concerns were mental health issues are going up because of COVID. And she, in a prior professional life had studied severe mental health crises because of the availability of these drugs in the home. She was also concerned that some people, while they might have been able to drive to Lexington Center, they wouldn't be able to drive to Burlington, or the other places that are the alternatives. So I got back to her as she requested after I spoke to Carrie. I have not heard from her again, so I'm assuming her questions are answered. But I just wanted to let you know that that had happened.
Okay, thank you. All right, we're moving on. Item 2, and it's been 2 hours. Okay.
Oh my gosh.
I know. Public health services update. Carrie, we talked about Robin and moving forward, and do you want to give us an update on, or Robin, on sort of, we're fortunate to have Robin with us now, but we won't have her forever.
Right. So my understanding is that Robin's available through the end of August. So what we want to do is be able to continue the position through the end of the year.
That would be great.
It's been invaluable in terms of the emergency dispensing site planning, the fall flu clinic planning, communications. I'll be giving this update later, but she prepared presentations for orientation for campers and staff and parents. So it's been really valuable to have Robin here.
Great, thank you. Any member of the board comment? Okay, we're going to move on. Thank you, Robin. We very much appreciate, and we would like to keep you longer, but something else calls. So we'll figure out. Okay.
We can just keep this meeting going. She can never leave.
That's right.
David, stop. Environmental health. Okay, camp updates.
So my understanding is that there are 4 camps this year. And I'll let Robin give an update on the presentations.
So Carrie and I, we were helping them plan out to be safe and open up the camps. And I think they were a little bit nervous, but I think they did a really great job. They gave us right before they were opening up what their opening up plan was like, and it was very good. And then I spoke on Monday and Tuesday mornings to the staff of their regular camp and then their tennis camp. And then at night, I spoke to the parents that were sending their kids on Monday night to the regular camp and then Tuesday night to the tennis camp. And we talked about public health measures. And I emphasized with them all that, that they were social distancing and washing their hands and wearing masks as much as possible at the camp, but that it was really important for families and for the staff to continue that during the week and the rest of the time, because it was everybody else wasn't going to be protective in camp if they weren't doing that outside of camp. So that was one of the big messages that we had. But I was able to take questions from the parents, and some parents were a little bit nervous, but I think they wanted to send their kids, and I think they were fine afterwards. And I think that the rec department, it was a great collaboration, and I think they did a really great job in thinking everything through.
That's great. It is wonderful to hear. So fantastic. See, we have good news. Okay. Pool variance requests.
Let me pull up these documents. It'll just take a minute. So we have 19 pools that have opened so far this season. Normally we do 32 pool permits in Lexington, so it's down this year because of COVID-19. These additional 3, so that'll bring us up to 22, do not have permits yet. They have not had their pre-operational inspections for the season, but they are requesting a variance from the pool code to not have a lifeguard on site. So this is a variance. A loft has a request. I can pull up. Element has a request for their pool. And then the other pool is the Quality Inn.
Okay. So the request is in. Are we obligated to do anything?
So the Board of Health does have to take a vote on whether they're going to grant a variance from the pool code to allow these pools to operate without a lifeguard on site.
And we've done this before for these pools, these particular pools, is that correct?
Yes, so these pools and also the others that we did in June. Typically in a normal season, we would be doing the pre-operational inspections and then issuing the permits and doing the variance along with that. These particular pools have not been inspected yet this season.
So, go ahead. Sorry, Bert.
Yeah, when we grant the variance, we have a requirement for signage too, in the past. Signage stating
Yeah,
that of the circumstances.
right.
I want to make sure that was clear before we go.
Okay, so where are we going?
Well, I can make a motion that we grant the variance to the pools listed as long as they've met the requirements
So they've passed inspection.
and they have the signage.
Okay.
Okay. Do I have a second? Dr. Geller?
Second.
Okay, we'll vote. Mr. Flynn?
Yes.
Ms. Will Fordham?
Yes.
Okay. Dr. Geller? Dr. Perlmutter?
Yes.
Dr. Hager Bernays, yes. Okay. All right, people swim once they're inspected. Okay, and our final, Carrie, are we good with that?
Yes, thank
Okay.
you.
Can I
Final,
ask one absolutely quick question? Are there any COVID-19 separation requirements or plans required from these pools?
So the pools, as all businesses do in the phased reopening, have standards. They're not required to submit a plan to us in order to open. But if we do get complaints, we would definitely investigate to make sure that they're complying with these standards.
Good, thank you.
you don't have to swim with a mask. Sorry, okay. Restaurant food establishment updates, please.
Sure. So I've been working with our health agent, Casey, and also with our per diem health agent, Crystal, to resume the routine food inspections that have been put on hold because of COVID. So we do have a number of food establishments that are now open for business. Some have outdoor dining. Of course, now where we are in the phases, they're allowed to be open for indoor dining as well. So those inspections are going to start next week. We did have an emergency with one of our establishments over the 4th of July weekend. 2 of our establishments, actually. It was Ixtapa and Wicked Bagel. There was a tank that was under, it was a compression tank under pressure that had burst. The fire department was called to the scene. They called me to the scene. Wicked Bagel had voluntarily closed to do the cleanup. And I worked with Ixtapa so that they would close and do the required cleanup. The tank that had burst came from their establishment, and so we had to make sure that they had hot water before they could resume operations. So that's been remedied now.
Okay, thank you. What is the priority for inspections at this point in terms of restaurants?
The priority is to go down the list and do all the restaurants that are currently open.
Okay, and do we have any of the inspection reports to date?
I've not been provided with the inspection reports. I don't believe the inspections have started though.
Okay, so once they start certainly in our next meeting, it would be excellent to see the inspection reports as we have in the past.
Yep.
Bert really likes to see the inspection reports. That's his thing. So that will be great to see. And I think a descriptive write-up of sort of the establishments, an update from their previous inspection, since it's really been a long hiatus for them. So that will be important to see. Any comments by the rest of the board? Questions? Sue?
I just wanted to go back to one thing. I was just checking to make sure I remembered this correctly. A loft at one point was going to be housing some COVID patients. I'm assuming that has ended and that they've cleaned everything up, right? Because otherwise I would be worried about the pool situation.
The last patient was discharged on June 11th, and so the hotel has been open to the general population. MEMA decommissioned their use of the hotel for that purpose.
Okay, thank you.
Okay, anything, Carrie, Robin? We're good? A date for the next Board of Health meeting? Should we go for a month from now, like our regular thing, unless who knows what? Okay, I don't know the date of that. Let's see. Anybody have a calendar?
Working on it.
Okay.
So today's the 15th, August
19th, isn't it?
19th.
Okay.
And we want to do 6:30 again? Is that good, bad?
It works for me. David, does it work for you? Because you're the other another working person.
Yeah, it's good.
Yeah. Okay. And it works for Carrie and Robin? Okay. Great. So with nothing else, we'll call the meeting adjourned.
Great.
Right. Have a good
Good night,
evening.
everyone.
Oh, yeah. Do we have a motion? You have a motion from Jay, second by Dr. Geller. All in favor?
Aye.
Aye.
Okay.
Good night.
Good
Good night,
night.
everybody. Thank you.
Thank you.